This is a framework that's being adopted by Healthy People 2020 this decade. We're really excited about being able to think in these terms. I think it's always been in the back of our minds, but we're now putting an actual name to it and trying to create tools and create efforts with this in mind. So it's something that we're really trying to bring into everything that we're doing within Healthy People. It's not a new concept, obviously. Social determinants of health are increasingly recognized as those elements that are very essential, that have to be addressed if we're going to make any kind of difference in the health of individuals and communities. And obviously, it's been around for a long time, but I think more and more people are starting to adopt it. As you can see, one of our overarching goals, goal number 3 for Healthy People, is to create social and physical environments that promote good health for all. And so it's really a part of what we're doing. We also have a new Social Determinants of Health topic area. And we actually just developed and went through the public comment process and had them approved for some new objectives that are now up on the website related to social determinants of health. The challenge, of course, is social determinants of health indicators that will lead you to understand whether or not you're impacting social determinants of health span across all different topic areas. So we don't have all of them in just that one topic area. It really spans across all of Healthy People, but we've tried to pick those out that we really think are key, that we need to make sure that we're addressing. So the way we are thinking about social determinants of health are that they're those social factors and physical conditions in the environment in which people live, learn, work, and play. They affect people's health status, their ability to function, and their quality of life. And they're the structural factors that mean they're not amenable to individual-related behavior change. They may limit opportunities for good health outcomes, and they may affect a community as a whole. So obviously they're incredibly important that we address. But how do you really move from concept to practice with social determinants of health? So I don't have an answer. There's no single answer. There's no magic approach, and I think it's something that we all struggle with. Part of the importance of social determinants of health is that the need to be aware of it and have it be a part of how you're thinking about your approach in addressing health in your community. Applying social determinants of health framework means that you are thinking about partnerships, both in the traditional and innovative ways, and thinking outside the box. In order to be successful, you need to carefully think about who's at the table. I want to just talk about an example real quick. This is our framework, how we have designed it. It shows the 5 determinants that we've identified for social determinants of health. And you can see that we have designed this to be interconnected so that you can see that it's a continuum. They all impact one another. So let's think about the social determinants of health leading health indicator, which is that we've identified as the leading health indicator, which is it focuses on students who graduate from high school within 4 years after starting 9th grade. Obviously, that indicator easily fits into education. Everybody would go directly to education. But when you're applying social determinants of health framework or concept, it's important to think about how else does that apply? Who else should be at the table when we're thinking about how to keep kids in school and get them to graduate? It affects everybody else. Economic stability. Without a high school degree, a high school diploma, how are you going to move forward? What are your chances of having strong economic stability in your communities? So it's important that you start thinking through how to get other members of the community involved. And that's one of the things that Healthy People can help with, because through our different tools, you can look at some of the relationships that the different objectives have to one another. You can look at the data, and you can use this kind of framework to help think through who might need to be at the table when you're trying to deal with a particular issue to break down some of those silos.